Hello, everyone. We are starting right away. Hello, everyone. Sorry, apology. We're having a technical issue. So we are very, very sorry. Very, very sorry. So we are starting right away. Welcome once again for another exciting episode of our Bella by Choice. As I carry Bella by choice, not by chance. So today, in continuation of our last week topic, Contraceptive Implant Part 2. Contraceptive Implant Part 2. We want to say a big thank you to our partners. Bella by Choice wouldn't have been possible without our amazing partner for their support. AWDF, Global Fund for Women, WFD, Movement for Women Alliance, DKT International Nigeria, Cross River State Ministry of Health, UNFPA, Cross River State Ministry Healthcare Development Agency. Thank you all so much for your support. So today, we have a wonderful and passionate speaker in our midst. His name is Farm Colin Obiosele. Welcome, sir. Nice having you here in our midst. Hello, sir.
Hello. Yeah, thank you.
Hello, Farm.
Hello. Yes, I can.
Can you hear me?
Yes, yes.
Hello.
Hello, can you hear me?
I can hear you. Good evening.
Oh, good evening. Thank you very much.
Welcome. Nice having you. Thank you so much for honoring our invitation. Okay, before we continue, we would like to do a brief introduction of our speaker. From Obiosele, a doctor of pharmacy in view, is a passionate public health, analysis, women and children rights activities. Collins has a strong focus on promoting access to essential medicine and quality healthcare for all. He is currently holding the position of Secretary General at the Pharmaceutical Association of Nigeria, student of the University of Benin, where he works to empower students to become leaders in the field of pharmacy and beyond. He has been actively involved in several advocacy and awareness campaigns aimed at promoting women and children rights, and he has participated in several health outreach where he has imparted knowledge of over 1,000 people on issues pertaining to human health, which is a cause close to his heart. He is a passionate advocate for social justice and strong believer in the power of education and community engagement to bring about positive change. As he has continued to pursue his studies and work toward his professional goals, he's also remained committed to making a positive impact in the world. Wow. That is very great. Welcome, sir, once again. Nice having you here.
Thank you very much. I really appreciate it. It feels good to be here.
Okay, you're welcome, sir. So last week, we were having a doctor in our midst, and the doctor was enlightening us on contraceptive implant and how does it work in the reproductive health of a young woman and adolescent. We're meant to understand more about contraceptive implant. That is a long-term birth control method, and it is an implantable medical device used for the purpose of birth control. A doctor enlightens us much on how implant is being used in our system, that it does not have any impact, but the only thing is a long-term birth control. And it also makes us to understand that it does not protect against sexually transmitted infection. So that alone, it was enhancing us that it's not good for you to be using implant and thinking that is that been saving your life for sexual transmitted disease. No. So today we have another person, another successful man in the field of pharmacy to also engage us on contraceptive implant. So we are going to move directly to case study. During the week, we have had an encounter with a young lady who shared a story with us, including how a man forced her to a contraceptive implant when she was just 15 years old. Very bad. So she said she was born into a poor family with 6 younger ones, and she is the firstborn of the family. Her parents could not avoid a better life for them, let alone paying her school fees. When she was barely 14 years old, her parents forced her into a relationship with a 45 years old man so that he could assist the family with some financial needs. The man told her that he was not yet ready to have children. So he introduced her to a nurse who inserted the contraceptive implant in her. And since then, the thing has been causing heavy flow with every monthly. She's affected her health. And the man is now married to another man with children, leaving her to her fate. She's seeking a solution on how to stop the heavy monthly bleeding. She's now pleading for everyone. What action can she take to help her? So if you are following us on YouTube, Bella by Choice or Movement for Women or African Girls Empowerment Network, please drop your advice to her. What can she take to stop her bleeding? Follow us on Bella by Choice. We are here. You can also drop your comment. So I will leave it to my follow hanger, Mrs. Tina, to go ahead.
Hello, good evening, everyone, and welcome once again to another exciting episode of our Bella by Choice Facebook live chat. It was so good to take up this case study of a young girl with quite a lot big dreams and vision, and encountering such as a result of our parents' inability to provide for their needs. And at this stage, these issues has been ongoing. I believe a lot of people out there, even if many of them will not want to share their stories, but right now will tell you that quite a number of women are also undergoing such challenges. And in this, we want to hear from our fam in the house to also share with us to throw more light on this, as also to encourage this young girl to stand firm and pursue her dream. So over to you, Fam Collins.
Okay. Good evening once more.
Sorry, sir, your voice seems too low for us to hear you.
Okay, I'm sorry. Good evening once more.
Good evening,
Hello, can
welcome,
you hear me
sir.
now?
Yes, we can hear you perfectly.
Thank you for having me here again.
You're welcome, sir.
Yeah, so from this case study now, this girl must have actually been forced to take implants at a very young age, which
Yeah.
is very pathetic. And
Yes.
she having no knowledge of what she's doing, because ideally these implants are meant for elderly people, so to say. They have come to a consensus that they are not ready to give birth at this point in time. So in order to carry out family planning, they take this contraceptive implants. But for this young lady, she was ignorant of that, and knowing fully well that these contraceptive implants have a lot of side effects, which is the first one here now is irregular menstrual bleeding, which I think is her case here. And I don't know if the implant has been removed. I don't know if you know, or it's still
Not yet,
there.
sir. Not yet, sir. At this stage, I don't think even the parents has an idea of how to go about it and all, because now she's left alone.
Okay, has she gone to see a doctor? Especially the doctor that implanted it.
Yeah, we actually advised, and then we actually advised her to go see a doctor, but from what she explained, this was carried out by a nurse, not a doctor. And at this stage, she cannot locate the person because it was a guy that took her to the place. So that is where the complications comes in. So at this stage, she might likely need somebody to guide her through, and she needs an advice. That is why we are calling on this call.
Okay, I would suggest that she gets the implants removed. So she go to see a doctor. And if she can't get the doctor that actually did the first one, that actually did it the first time, she'll have to like carry out a scan or something. So they can ascertain the exact point the implant is. Then they will give her any anesthetic, so she won't feel any pain, and they remove the implant. So once
Oh,
the implant
so
has
sorry, sir.
removed,
Honestly, we are struggling to hear you. Your voice seems too low, like far away from
okay,
the mic. So could you please help adjust?
can you hear me now?
Sure, we can. Sure, we can. Go ahead, sir.
Is it better than before?
Yes, it is. It is.
Yes, sir, it is.
Okay, from what I said before, I think if she can't get the doctor or the nurse rather that did the implant initially, she can as well go and meet another doctor who is going to try and ascertain the exact point that the contraceptive was implanted, then give her an anesthetic drug so she won't feel any pain. Then they will have to remove the implant immediately. So once the implant is removed, I think the heavy bleeding will stop. That is it. So that is her own method of reacting to it.
Okay. Thank you so much
So
for that advice, sir. And I believe also other young girls out there will learn from this to be able to speak up, because a lot of them are suffering from this and are unable to speak out. And now you can see that a problem shared it's half solved. All right, so we'll move straight to the question. The discussion for today's section, just like it has been earlierly introduced by one of the co-anchors, but as we proceed to the discussion proper, I will be hanging off here to another co-anchor. Elizabeth Jonah, are you there?
Okay. Yes, I am. Good evening, everyone.
Good evening.
Good evening. Welcome.
Hello, can you hear me? Yes, good evening. Thank you.
Yes, we can.
Yes.
All right. Okay, once again, thank you so very much from Collins for joining us. It's we're so glad to have you on
You're
the
welcome.
call. All right, yeah. We're taking this is part 2 of the same topic, contraceptive implants. Last week we had an amazing speaker who opened our eyes to contraceptives, implants, and how women can benefit from it. So we'll just be taking more questions on. So we'll go straight into the questions without further wasting of time. It says, are there any lifestyle factors or habits that may affect the effectiveness of these implants?
Okay.
Hello, sir.
So yeah, I'm here.
Okay.
So I'll start by defining contraceptive implants. These are small, flexible, hormone-releasing rods or capsules that are placed under the skin of a woman's upper arm, and they are long-acting for like 3 to 5 years, depending on the type that is being used. So back to the question now. Talking about lifestyle factors or habits that may affect the effectiveness of the implants. We have basically drug interactions. Bearing in mind that the implant is going to be in the body for a long time, like 3 to 5 years, as I said before. So there are some drugs that it's not that the person cannot take it, but if you take it, it's going to reduce the effectiveness of that implant. So it's advised that if you take these drugs, you actually avoid having sexual intercourse during that period. So there's some drugs like drugs used in the treatment of HIV now, for example, drugs used in treatment of tuberculosis, epilepsy.
Wow.
We have drugs like that, carbamazepine, bisofluvin, and the rest. So there are some people now that are actually like epileptic patients, and they can't do without taking these drugs. So that's where drug interaction comes in. It's just you have to set the proper timing. If like it's better you don't take this drug like 3 to 4 hours before sex. So to risk so you not be at risk of pregnancy. Then we have grapefruits and other juice. Like grapefruit is known to interact with many drugs. That's why sometimes they will tell you that if you are taking this particular drug, don't take orange, don't take vitamin C and stuff like that. So you have to avoid grapefruits. Like I said, the period of 3 to 5 years, there's no how you can actually avoid it, like totally. So for the period that the person is going to actually have sexual intercourse, to try and avoid it. Then excessive intake of alcohol is also a factor. Then smoking. Yes. That's for now. Thank you.
I'm actually learning a lot. I had no idea. Thank you so very much, sir. I had no idea that grapefruit or an orange can actually, affect implants. Okay, so what are the alternatives to implants if as a young lady or young woman that is considering a different contraceptive method?
Okay.
She must have, maybe she has heard of, maybe she's sort of scared of, what might happen if she puts the implant. So she's asking what if there are other different contraceptive methods. You can go ahead.
Okay. So contraceptive implants is just one method of that is
Okay.
yeah. There are other methods. Like we have
Wow.
the normal emergency contraception pill that normally take. Then
Pill, yeah.
oral pill
Yes.
like postinol 2 and all. So we also have natural methods, natural family planning, fertility awareness based
Okay.
methods. The withdrawal method is part of it. Then, I think you can also make use of these fertility apps, just like the apps that some ladies use for their period. This flow app can use to calculate, just like that. Then we have similar to this contraceptive implants. We have the intrauterine devices, IUDs. These are small. I don't know if you can hear me. Am I audible enough?
Okay.
Wait,
Hello,
can
sir?
you hear me?
Yes, I can hear
Am
you.
I audible enough? Okay.
Yes, sir, very much.
So the intrauterine devices now, they are small contraceptive devices that are inserted into the uterus to prevent pregnancy. Then we have barrier methods. Barrier methods can be divided into the external method and internal method. The external method, these are the male condoms. Are you following? Yeah. Then the
Yes, sir.
internal method. Okay. Then the internal methods are the female condom, which you have to insert inside the vagina. Then we have the tubal ligation or sterilization. So this tubal ligation, it involves an operation whereby the lady's fallopian tube is being tied or are being tied rather. And this one is irreversible. Like it's going to be a permanent method. Then similar to this tubal ligation, we have the vasectomy, whereby the vas difference in the man are also being tied. The vas difference are these are this organ, the reproductive organ that how do I put it now? That actually facilitate the passage of sperms,
yes.
To the urethra. So once it's being tied now, the man cannot impregnate a woman again. So these two methods now,
forever.
Yes, forever. This is when the couple or the person is sure that it's not like they're not interested in child bearing again. That's when they can actually carry out this method. So I think that's that. But in all, this there's no method of contraception that is 100% effective against pregnancy. Like you said now, when I was explaining this lifestyle factors, you can still have an implant and you'll be taking drugs that will interact with that implant. And imagine you get pregnant after
pregnant. Yes.
the implant is not working.
Yes.
Not knowing that
one might think it's not working.
Yes, but it's drug interaction. So these mistakes can also lead to the pregnancy.
Okay.
So just that implants actually like the safest. Should I say the safest? Okay, one of the safest methods so far. Yes,
compared
and it's
to
also
other
advised
methods.
It's also advised to use the condom with the implants while taking the implants for optimal effectiveness.
Okay.
Yes. So
all right.
Thank you.
Thank you very much, sir. We'll move on to the next question.
Okay.
Next question, please. So So it says, as a young woman or as a young lady, how often do I need to follow up with my healthcare provider after getting the implant?
Okay, basically we were encouraged to do general medical checkup from time to time. But after getting
Okay.
the implant, after getting the implant, I think your doctor or nurse will tell you that if you experience any side effects, like I think for a period of like 3 to 6 months, you are going to be like under watch from the doctor. So they're going to tell you that if you experience any side effects, you should like report back to him. That side effects include like that irregular menstrual bleeding. It's just come like that, heavy flu, then headaches, nausea. We have breast pain or breast tenderness, weight gain. It can also lead to an infection where the implant was inserted, probably like
Wow.
due to unsterile procedures and all. As in, so anything can happen. Then it can also lead to blood clots, changes in mood, that's a mood swing. So if the lady is experiencing symptoms like this, can as well go and meet her doctor. But apart
So
from
what
this,
if,
okay.
like, what if she does not experience any side effects? Should she still go for like follow up every, you said 3 to 6 months, right?
Yes, like 3 to 6 months, but it's not compulsory. But at least just give
Okay.
your doctor feedback. It's not mandatory
Okay.
that you have to go and see your doctor.
So in the
So
space
that's
of
just
the 3 years that you said, I remember you saying an implant can stay 3 to 5 years in a woman's
yes,
body. So within that period, she has to go for like maybe 6 months checkup constantly
like
before
every
it's
six
being
months.
removed.
Yes,
Every 6 months.
yes,
Okay.
yes.
All
Ideally.
right. Thank you, sir. Okay.
Well,
All right. We'll move to the next one. So, how is the implants inserted, and from what age, as a woman, as a young lady, what age bracket is meant to have that implant inserted?
okay. Ideally, a woman of childbearing age. There's no any age bracket that is really meant to have the insert. But from 55 years below, any lady that is capable of giving birth can have an implant. But like the case of that young lady
Okay.
now, that she was, I think, not 13, 14. It was a young lady. She taking the implant was not wrong, but
Okay.
she had side effects. And like I said now, you have to actually like um do regular checkup with your doctor and all. So she had gone back to her doctor and
Okay.
complained about these stuffs. Then doctor will know, okay, maybe this particular implant is not suitable for her and change it. So there's no age as far as you're actually like mature, capable of giving birth. An implant is necessary. Okay, then how is the implant inserted? The implant is
Inserted.
inserted, like I said before, by using. Okay, at first you have to give a local anesthetic injection. A local anesthetic injection is injection you take to reduce pain or to cause numbness. There are different types of anesthetic. You have the local and the general. So the local is for just the arm where you're going to insert it. So when you give it at that arm, the person is going to feel numb, like the person will not feel any pain there at all. The pain receptors will be down. So then you can also use a freezing cold spray at the top of the arm. Then the doctor or the nurse will then insert the implant just under the skin of the upper arm. I think yes. This This diagram is just here.
Just as
That
it's shown
particular
in
thing.
the diagram.
Yes,
Yes.
yes, exactly as it's shown there. So we just insert it there.
Mm.
Yeah.
Okay.
Yes.
All right.
Bueno.
Okay. So now can the implants be removed before its scheduled expiration date? Is it possible? Will it
Okay.
affect her in any way? Will it lead to side effects, or is it something that can be done?
Okay. The implants can be removed at any time,
Hello, sir.
but it's can you hear me?
Look, I see them now.
Hello?
Mm.
Hello,
Hello,
can you
sir.
hear
I
me?
can hear you.
Okay. I said the implants can be removed at any time, but it should not exceed the expiration date so that it should not lead to toxicity. So like the implants now, for example, now within that 3 to 5 years, the couple or the lady involved can actually say she wants to start giving birth now. Then she can go to the doctor and get the implants removed. So anytime the implant is removed, her natural fertility will return very quickly. So then if she wants to put another one, she can put another one, but not the one that she used before. But the implants can be removed at any time, depending
Okay.
on the lady wants.
Okay. Hmm. Okay. All right. Thank you so much, sir, for answering all these questions. Honestly, I don't know about everyone here, but I've learned a whole lot concerning the topic today. It was really insightful, sir. I don't know, since the live chat is being streamed on Facebook and YouTube, Tina, are there any questions from any of the women on social media? If not, we can just, round up for the day.
Okay.
Hello, Esther, Tina.
Yeah. I think there's no question for now, so you can round up.
Okay.
You can also
Well, Madam
right.
Tina, do you have
Okay.
any question?
Hello, thank you so much, Doctor.
Yes, you're welcome.
Sorry, I was told you were a farm. Okay, doctor in view. Yeah. All right. So thank you so much for that wonderful presentation. I would say you've done a lot of justice to this topic because there have been several cases of women undergoing implants without knowing what's the challenge, or if there is a challenge, or if there is no challenge, and a lot of myths and misconceptions surrounding this. And I believe with what we've learned today, they will be able to know that, okay, fine and good, there are no more, okay, we can overcome the misconceptions. Yeah, let me use that word. Because a lot of women would say, I am pregnant and I am bleeding. What is the problem? And there won't be, they ask themselves and there won't be an answer to that. So, but I believe with what we've learned today, we'll be able to know what we are supposed to do as young girls and women out there. If you're undergoing this, you want to go for this, it is not a bad idea. You can, just like what the pharmacist has said, it is not bad. So, but kindly pass through the right persons to do this. Pass through the right person. That's what I've learned from this. So if you go through the wrong path, there will be issues and complications. So thank you so much, sir.
You're welcome.
Tina, we'll just quickly.
We are rounding up.
Yeah, I just want to do a full quick recap for some of the women that joined us late. We're still on the topic contraceptive implants. Last week we did the part one. We had an amazing speaker who really, opened our eyes to what contraceptive implants is all about. And today is the part two with our pharmacist, and it was really insightful. So he mentioned some things, that can hinder the effectiveness of contraceptive implants. Made mention of grapefruit. I know a lot of us do not even know about it. Grapefruit, orange, alcohol, smoking. So if you're a woman out there and you have this implant and you'll be wondering why maybe it's not working or something like that, you have to check what you've been taking, because it might actually hinder the effectiveness of the contraceptive implants. And our pharmacist also mentioned other alternative methods. Maybe you're not too comfortable with the implant itself. The other alternative methods like the withdrawal method, taking of pills, condoms. That's the external method, and then the internal method, which are the female, um, which is the internal method. Then he also spoke about how often a woman should go for follow up, because we made mention of 3 to 5 years for the implant to stay in a woman's body. So she can go for follow up every 6 months. It wouldn't hurt to actually know what you're doing. Go up with your have a follow up with your healthcare provider to know how far you've gone or how well the contraceptive implant is really blended with your body. And then the sweetest part is that you can get to remove it at any time of your choosing. Although it's meant to last, it has a lifespan of 3 to 5 years, but you can decide to remove it after 2 years or even a year. But just for you to make sure you visit someone, an healthcare provider that really knows what he or she is doing. Okay, are we all here? I hope we all got that. Okay, we would be thank you everyone for coming for to today's live chat. Now, you woman with unmet sexual and reproductive health needs, you can please speak with our sexual and reproductive health experts today by calling the numbers on the screen 070-480-65486 or 070-480-65450. That is our Belle by Choice hotline. We have a Belle by Choice team, Paddy. Yes, so our Belle by Choice Paddy that is ready to answer your every question that has to do with your sexual and reproductive health. You can also chat with us on WhatsApp via our Ali chat box, our Ali chat bot. Just call the number on the screen or dial our Honey and Banana Connect um 7790, and it is all for free. So you don't have to bother. I don't have airtime, but I need some of my questions answered. You can just dial 7790 and our Honey and Banana Connect all for free. Okay, if you're also in Cross River and you want to talk to a sexual provider, you can also dial the numbers on the screen. You can also dial the numbers on the screen. Next slide, please, so they can see the numbers to call. Hello. Okay, you can dial the numbers on the screen. We have local government areas in Calabar where you can just walk into, and then they will answer any of your sexual and reproductive health questions that you might have, and you'd have first-hand one-on-one consultation with an healthcare provider. Okay, also if you're in Lagos, do well to dial the numbers on the screen too. Next slide, please. If you're in Lagos, please put the Lagos slide up so they can see the numbers to call. All right, everyone, thank you so very much for joining us on today's live chat. I'm sure we all learned one or two. I'm very certain I learned something too. So we would be calling it a day. Thank you, pharmacist Collins. Are you still with us, sir?
Yes, I'm still here. You're
Okay,
welcome.
thank you so
I
very.
was actually
Thank you,
commend you guys
sir.
for such a wonderful initiative. Led by
Mm,
Choice African Girls Empowerment. I'm really
Permanent
impressed.
network.
I'm
Thank
really
you,
impressed.
sir. Thank you very much.
You're welcome.
Thank you, sir. Yeah. All right.
All
Let's call
right.
it a day. We'll see you same time on our Belay by Choice live chat next week, Thursday by 5 p.m. Take care, everyone, and have a blissful weekend. Bye.
Same to you. Bye.
Bye. Yeah. Bye.